Good evening. I'm Dr. Rohit Ravindran. I'm the head of the Department of Gastrointestinal Surgery. So today I'll be talking about this OT safety in our gastrointestinal OT operation theatre. So in Meitra, patient safety is paramount importance to us, and we always keep that above anything else. So we do not compromise on the safety for the patient. So I'll just take you through few of the things we have which might not be there in the other hospitals, which makes us stand above others. So I'll start with the operation theatre itself. So we in the operation theatre, we have something called as a laminar flow. Laminar flow is most of the air actually comes from the HEPA filters. This is the HEPA filters, what you see above. It's a filter which actually prevents any microorganisms to come into the operation theatre. The pressure inside the theatre is maintained at about 2 to 3 pascals, so that the room inside the operation theatre has high pressure. So this prevents the air from coming into the room. So the only air which comes in is through the laminar flow. The other thing what we do in this theatre is we keep the temperature at about 18 to 22 degrees Celsius, and also the humidity is kept at a very low value, less than 60%. This actually prevents the growth of bacteria and fungus, which can cause infections in the patients undergoing surgery. So the other few factors I want to tell you about is our laparoscopic instrumentation. So this is what we call as a 4K system, 4K laparoscopic system. This has got a special feature which is called the ICG feature, that is indocyanine green feature. So in this system, we inject the patient with a dye, and that dye actually goes through the liver and into the bloodstream. This can be viewed by specific instruments in the laparoscopy. So which helps us to determine few of the blood supply to the intestine, as well as to visualize the liver and the bile ducts. So this actually increases the safety for the patients during surgery. So other things which I would like to specify is these are the laparoscopic instruments we use. Most of the hospitals, what they do is they have only one set of laparoscopic instruments, because these are very expensive to be invested on. So in those hospitals, these instruments after surgery, they are washed properly and then put in a solution called as OPA solution, and kept for about 10 minutes for sterilization and retaken for the next surgery. So that's how it happens in most of the hospitals. But in our hospital, keeping the patient safety as the most important factor, what we have done is we have brought around 5 sets of these instruments for our surgeries. So all these instruments are taken down to a sterilization room, and special sterilization like ETO sterilization is done for each and every instrument being used in a patient. We do not use the solution. This actually increases the sterility of the instrument, and the chances of infections also become less. These instruments are, again, they come back from the sterilization room in these packets, and as you can see, these are kept inside this box and sterilized and brought back to our surgical room for use in patients. So this is how they come back to us. Thank you.